antibiotics have saved the human race a lot of suffering from bacterial disease. Without antibiotics, millions of people would have succumbed to infectious diseases. Regrettably, antibiotics resistance currently threatens the effective treatment of infectious diseases. In this special report, AIT's Halima Fashaki takes a look at the role of medical laboratory scientists in preserving these life-saving drugs for future use as Nigeria joins the rest of the world to mark the 2017 Biomedical Day.
Antibiotics are lifesavers. If they didn't exist, far too many people would have died young from an infected scratch, a fever, an episode of dysentery, or a painful pneumonia. This is particularly true in Nigeria, where bacterial infections are common. Antibiotics play a critical role in reducing the burden of communicable diseases all over the world. But recently, antibiotics developed resistance, creating a public health concern.
Most of these drugs, have combined with each other to form, to interact, what we call drug interactions. And when you do not see your doctor or medical professional for proper diagnosis of your ailment and then prescription of medicines, and then you go over to buy some of these drugs. Now, you sign the risk of having drug resistance to some of these medication.
Virtually almost every organism has developed what we call drug resistance. And when drug resistance is developed, it therefore means that in essential cases, you will hardly find a drug that will be useful for these infectious diseases.
Biomedical laboratory scientists have blamed the rise in antibiotic resistance to the use of fake and counterfeit medicines, self-medication, and non-compliance to prescribed treatments, among others.
Some of the factors that can actually lead to antibiotics resistance has to do with misuse of drugs and abuse of it. And you discover that over time, people, without no just reason, they will just start using antibiotics. Some of them will use it prophylactically, not that they are down with any form of infection, but they just felt, prevention is better than cure.
It also leads to damage to organs and the systems of the body, because some of these antibiotics have toxic effects on some organs of the body. There are some of them that have what we call nephrotoxic effects. They have effect on the kidney. There are some that have what we call ototoxicity, in which case they lead to hearing loss if they are used unregulated, and so many other side effects.
In Nigeria, almost everyone is involved in self-medication, and the lack of appropriate legislation to ban certain drugs over the counter further worsens the situation.
Most Nigerians just walk up to pharmacy shops and buy drugs, because they don't want to go through the rigorous processes of seeing a doctor in the hospital. So they think shortcut will help out. But at the end of the day, it has negative impact and implication on the entire system.
A medical laboratory scientist is responsible in finding out the cause of diseases, which ensures better treatment and cure.
One of the major roles that medical laboratory scientists can play is by awareness. Educate the masses, educate our patients, educate the client out there to understand the fact that wrong use of antibiotics could actually lead to resistance.
For them, urgent and coordinated action is required in educating the general public on the appropriate use of antibiotics. Halima Fashaki, ANT News, Abuja.